everybody? We'll finish it up fast. Okay? Let us focus. Come on. Come on, everybody, let us focus. We'll finish it up fast. Okay? Okay. So next to the sigmoid column will be the rectum. After rectum, there will be anal canal. Okay, anal canal. Anal canal is situated from where? First of all, this is the sacrum over here, for example. Rectum will be till this part. And this is the anal canal. Okay, if you see the sagittal section, this part is the rectum in the lower end of the coccyx over here. About 2 centimeters or 2 to 3 centimeters below and in front of the coccyx over here is the ano-rectal junction over here. So if you see properly, this is the anal canal, which is about 4 centimeters in length. Length of the anal canal is important. Okay, roughly around 3.5 to 4 centimeters is the length of the anal canal, and the anterior wall is shorter compared to the posterior wall over here. There you go. The anterior wall of the anal canal is shorter than the posterior wall. Okay. And this anal canal will be opening outside and through an aperture, nothing but the anal orifice. These terminologies are very much important. Okay. So this is the sagittal section, and we are focusing now in the which section is this? Which section is this? Coronal section. So coronal section is this over here. Okay, coronal section in this manner. Okay. So this is the entire anal canal, which is divided into 3 areas over here. Within the interior of the anal canal. We will discuss the exterior very easy later on. First of all, the interior of the anal canal is very much important. So anal canal is lined by which mucosa? I mean which epithelium? Probably by which epithelium? Stratified, squamous, keratinized or non-keratinized? Non-keratinized, obviously. It is not a skin. Okay, to get keratinization. So easy to remember, whatever the things which are exposed to the external environment, okay, which are having the mucus secretions over here, above or below, those are lined by the stratified squamous, non-keratinized epithelium. For example, you take the mucosa of the buccal cavity, mucosa of the vagina, mucosa of the anal canal, mucosa of the esophagus. All these are very much close to the external environment, which undergoes wear and tear. What is wear and tear? It will undergo friction because of the food substance or fecal matter or whatever it might be. Okay. So at that area, to prevent the injury, there will be stratified layers of epithelium and non-keratinized. Okay. Why keratinization is needed? Why keratin on the skin is needed? Protection, obviously. So it is already in the inner aspect. The anal canal or vagina or the buccal cavity is already inside the body. It is not exposing outside. It is very much close to the external environment, but it is inside the body. So keratinization is not needed. But stratified epithelium is needed to prevent the wear and tear of the skin or whatever, to prevent mucosa or whatever it might be. Okay. So anal canal is also lined by stratified squamous, non-keratinized epithelium, but also it will be lined by above. Okay. So are there doubt whether the anal canal is over or not? Okay. So anal canal is partly down. The upper part will be developed from the endoderm. Okay. So endoderm is lined by generally all the way from above onwards. Simple columnar epithelium. So the upper part of the anal canal is lined by the simple columnar epithelium, and the lower part is lined by stratified squamous, non-keratinized epithelium. So it belongs to ectoderm. Okay, so skin and everything, and the appendix or whatever. So in this manner, the epithelium difference is above the upper third of the anal canal is lined by simple columnar epithelium, and the lower 2/3 is lined by stratified squamous, non-keratinized epithelium in the middle part, and keratinized epithelium in the lower part, because it is continuous with the skin over. These differences are needed. Okay. So let us see what are the things which are present in the interior of the anal canal over here. Okay. First of all, it is divided into 3 zones over here: upper, middle, and lower zones over here. Okay. So this division is done by a line over here, which is termed as the, you already know it. Pectinate line. Okay. It is not pectineal line. Pectineal line is nothing but pecten pubis, but this is called the pectinate line. Okay. So musculi pectinate. Pectinate means pectinate or pectinate means comb line. Comb line. Pectineal is a different one. Okay, so pectinate line is over here. Okay, which is formed by the, we'll discuss that here. Okay, so this line, pectinate line, divides the upper 1/3 from the lower 1/3. Sorry, middle 1/3 over here. Okay, and the middle 1/3 will be dividing the lower 1/3 by means of a white line card. Hilton's white line. Okay, so two lines dividing the entire anal canal into three zones over here: upper, middle, and lower zones over here. Always remember, don't confuse. Hilton's white line will be outside, and pectinate line will be inside. Okay, two lines. Okay, so let us focus on the upper 1/3 over here. The upper 1/3 of the anal canal contains mainly the anal columns. What are anal columns? These are the longitudinal mucosal folds on the upper 1/3 of the anal canal over here. These are the permanent mucosal folds. Getting it on? These are not temporary. Just like the rubia or whatever, it's not said temporary. These are permanent mucosal folds. Okay, so these are the longitudinal folds over here. So these are nothing but the anal columns over here. Okay, so the lower ends of the anal columns are connected by means of a semilunar shaped mucosal folds. Once again, mucosal folds, those are termed as the anal valves over here. Okay, this is termed as the anal valve. Okay, so anal valve will be in this manner, semilunar shape, and is connecting the two lower ends of the anal columns over here. Very good. Okay. So from this anal valve, there will be epithelial outgrowths over here. Those are termed as, what is meant by papillae normally histologically? Foldings. Elevations. Projections. That's the difference. Okay. So papilla means on the tongue or in the dermal papilla, whatever it might be, the lamina propria will be projected into the surface epithelium and will be producing a projection of down. That is called the papilla. Do you understand? So the content of the papilla is squamous epithelium along with the underlying lamina propria over here. Getting it out? Right? So anal papilla. So these are the epithelial projections all the way from the mucosa over here. Getting it out? Mucosa is lined by the epithelium over here. So those epithelium will be again projecting over here in the form of papilla. So what might be the content of this papilla now? Epithelium along with the lamina propria, which is in the mucosal region over here. Getting it out? So anal columns, anal valve. From the anal valve, so epithelial projections will occur. Those are termed as the anal papillae over here. Okay. So we open the anal papillae now. So we have aortic sinuses. What is the need of aortic sinuses in case of heart? Got it? For what? There is a reason for aortic sinuses above the semilunar valves. What's the need? There is an aortic dilation. In this manner, there is an aortic dilation. Semilunar valves will be present over here. Above that, there is a space over here. What for? Those are termed as the aortic sinuses or pulmonary sinuses. Coronary? What's the need? Infections. Pressure. So we try to find it out and tell me in the next class. Okay. That you must know. Okay. So above the papillae, see it everybody. So above the anal valve over here, there is a space lying over here, which is termed as absolutely the anal sinus. Anal sinus is over. Okay. Anal sinuses. So far, whatever the terminologies applied over here, first of all, there is anal columns. These terminologies are very much important. That's why I'm repeating again. These are the anal columns over here. Adjacent anal columns are connected by means of the semilunar anal valves. From the anal valves, epithelial projections will occur. Those are termed as anal papillae. And above the valves, there is a space, recess. That is nothing but the anal sinuses over here. Okay, what is the problem of if the anal sinuses are present? What is the problem? Any foreign body, for example, a patient has been eating the chicken bones or whatever it might be. That will be the foreign body for our body, isn't it? Until unless it is digested and absorbed, it will be like a foreign body. It can't stay in our body, isn't it? The undigested matter will be evacuated outside in the manner of feces, fecal matter, isn't it? So if the bone is not digested completely, or any cellulose material is not digested completely, that can stuck at this region, and if it is stuck at this region, what will happen? It may be irritating the mucosa over here, that is leading to the inflammation, and of course that will be leading to the infection, and that leads to inflammation and perforation of the anal canal might also occur. Okay, that is the problem with the presence of the anal sinuses. So how to prevent this lodgement of the foreign body over here? The patient should eat fiber-rich diets. So no constipation should be there. What is constipation? In area?
Not passing on the
For more problem.
as a 2 times in a week.
Three times a week. Okay. Constipation means if a patient can't able to pass motion 3 times a week is called the constipation. Okay, one time if he can't able to pass, it's not a constipation. If it's 3 times, he should not pass. Okay. Right. So the constipation leading to the hardening of the stool over here, that will be lodging the fecal matter over here, just like the fecalith over here, or any foreign body like chicken bone or fish bone or whatever it might be. It might be lodging over here, leading to the infection and inflammation further followed by perforation. Okay. So this appears to be, this upper one third appears to be bright red in color because of the presence of, because of the presence of vessels which are termed as the superior rectal vessels. The entire anal canal is supplied by superior rectal vessels and inferior rectal vessels. That means arteries and veins as well. Okay. So superior rectal vessels will be draining into, first of all let us see the arteries over here. The arteries will be supplying till the pectinate line over here. Getting it? The arteries will be supplied till the pectinate line. From below the pectinate line onwards it is supplied by inferior rectal arteries. Inferior rectal artery is a branch of internal pudendal artery. Okay. So internal pudendal artery will be supplying the rest of the part of the anal canal. Above it will be supplied by the superior rectal artery, which is a branch of what is it? Inferior mesenteric, that continues as superior rectal artery. Absolutely. Okay, superior rectal artery continues as the inferior mesenteric artery. Okay. Okay, fine. What about the veins over here? The veins will be draining into this part. The veins will be draining into superior rectal veins drains into inferior mesenteric vein. Inferior mesenteric vein will be draining into splenic veins. Splenic vein ultimately drains into portal. What about this part? The lower part is supplied by the inferior rectal veins over here. So inferior rectal veins drains into internal pudendal vein drains into internal iliac vein. So internal iliac vein ultimately drains into what is it? Okay, common iliac vein and then inferior vein artery. So above it is draining into the portal vein and below it is draining into systemic vein. Okay. So by this you can, and one more thing, the lymphatics which are draining the upper part, this part will be draining into internal iliac nodes. Okay, remember this. This upper part will be draining into internal iliac nodes. That means the lymph nodes which are around the internal iliac artery are called the internal iliac nodes. Okay. So this upper part will be draining into internal iliac nodes and lower part will be draining into superficial inguinal lymph nodes. The inguinal lymph nodes will be situated at the superficial inguinal region. Lymphatic system will be dealt in the lecture class. Dealt or not already? Not yet, right? Okay, it will be dealt. Okay. So there are two things. The upper part is draining towards the internal iliac nodes which are situated towards the posterior pelvic wall. Okay. And the lower part will be drained into the anterior aspect. So one towards the posterior aspect, one towards the anterior aspect. Okay. By this you can understand this area is a dividing point between endoderm and ectoderm and the portal and systemic veins over here and superior mesenteric artery, inferior mesenteric artery and pudendal artery over here, and the lymphatics also here it will be draining into internal iliac nodes and here it is draining into superficial inguinal lymph nodes. Over the inguinal region there are superficial deep group of lymph nodes into which the lower part will drain over here. Okay. So this is a dividing point between these two areas, either arteries or veins or lymphatics over here. Whenever a single structure is divided by two different lymphatic systems. That is termed as the watershed area. Okay. So this watershed area will be asked in the exam. This watershed area will be asked in the exam. And one more thing, the nerve supply of the anal canal also above will be supplied by which things you can expect. Above will be supplied by autonomic nervous system. One is the sympathetic nervous system from L2 and L3. Okay, and parasympathetic nervous system from S2, S3 and S1 as usual. But this lower part will be supplied by somatic. Right from the pudendal branch over here. Pudendal nerve will be supplying it over here. Get it over? So two different nerve supplies, two different lymphatic supplies, two different blood vessels and two different of course nerve supplies over here. Okay. So this acts as a watershed line for the lymphatic system, lymphatic drainage over here. Okay. So coming to the intermediate part, it appears to be more bluish in color over here because of excessive venous plexus at this level. Get it over? So here the anal columns, in between the anal columns there will be superior rectal vessels, that will be superior rectal artery and of course superior rectal vein also. Okay. So if there is any portal obstruction over here, what might happen? What is it? Hemorrhoids. What are those hemorrhoids? Piles, of course. The other name for hemorrhoids is piles, is okay. But what is hemorrhoid means? Dilated veins in the anal canal is termed as a hemorrhoid. Okay. So if there is a portal obstruction above, so these veins will get dilated. So here the dilated veins are termed as the hemorrhoids, which are termed as the internal piles or internal hemorrhoids. Okay, internal piles or internal hemorrhoids. Internal piles or internal hemorrhoids. Most probably these piles are situated at 3 o'clock and then 11 o'clock and 7 o'clock positions. Okay. So these internal piles or internal hemorrhoids will be generally situated. If you take this is the anal canal over here. This is the anal canal. From below upwards you're looking at. You're looking at the perineum. Okay. For example, if these two are the lower limbs over here. These two are the lower limbs over here. The patient's anal canal from below upwards you see, from the perineal region. Okay, in between the two thighs, you are looking from below upwards over here. Okay. So these veins will be dilated at the level of 11 o'clock, 7 o'clock and 3 o'clock positions. With respect to the patient, this is the right side and this is the left leg over here. Right leg and left leg over here. With respect to the right side, 11 o'clock and 7 o'clock positions over here. With respect to the left leg, there is a 3 o'clock position. Hemorrhoids or internal hemorrhoids over here. These hemorrhoids will be extending downwards over here to the exterior over here. Getting it all the way from this part, the dilated veins can be suspended all the way from the upper 1/3 towards the outer aspect of the anal canal as dilated veins over here. What might be the complication occurs over here? So these veins, because they are getting exposed to the outer aspect, these veins might get infected over here. That infection leads to thrombus formation. That thrombus might go to the portal circulation above. Getting it? So this is a complication of the internal hemorrhoid over here. Okay. And these hemorrhoids will easily bleed. What is it? These hemorrhoids will be easily bleed. For example, there are external hemorrhoids. For example, the veins which are formed over here, get dilated over here because of the obstruction of the inferior vena cava. Because the lower part is supplied by the inferior vena cava. Is it not? So if the veins are dilated over here, these also will be exposed outside over here. But these will easily bleed compared to these veins over here. What might be the difference over here? Simple. These are lined by mucosa, only mucosa over here. But from here onwards, it is lined by stratified squamous. That is nothing but the ectodermal epithelium over here. So indirectly, it is almost equivalent to the skin, apart from the keratinization. So that thick layer of the stratified squamous epithelium will not allow these the hemorrhoids to easily bleed. These can easily bleed, but these can't be easily bleed. So what might happen? Again, the chance of infection will be present over here because these are exposing it to outer aspect over here, and these will be giving rise to more pain. Here there will not be any pain. What will be the difference over here? Two sorts of hemorrhoids, which are the dilated veins over here. One can easily bleed because it is lined by the mucosa over here, and one is lined by Stratford's squamous epithelium, so it can't bleed easily that easily. And the pain from these hemorrhoids doesn't pain over here, but these hemorrhoids will pain. Why so? Nerve, okay. Both are having the nerve endings, right? Then what's the difference? Always the somatic nervous system will carry the pain, is it not? So from this part onwards is the ectodermal region, is it not? From this part, from below the pectinate line is the ectodermal region. So ectodermal region is supplied by the pudendal nerve over here, which is somatic part of this anal canal over here. Get it or not? So the pudendal nerve will be carrying the pain sensation over here because it is somatic, right? Just like the visual pleura and parietal pleura, which one is pain sensitive and which one is pain insensitive? Parietal pleura is pain sensitive, visual pleura is pain insensitive. What about the peritoneum? Parietal peritoneum is insensitive or visual peritoneum is insensitive? Both are sensitive to pain. Okay. Why both are sensitive to pain? Simple logic. Both are supplied by? No. Exactly. Parietal peritoneum is supplied by somatic nervous system. The lower 6 thoracic nerves and their cutaneous distribution will be found in the somatic nervous system. And why visual peritoneum must be paining? Sympathetic nervous system. The visual is supplied to the sympathetic nervous system. The sympathetic nervous system will be carrying the pain over here. So obviously the visual peritoneum is attached to the viscera over here. So from the visual peritoneum also the pain will be carried because both the nerves supply. That means the viscera and the visual peritoneum over here, both are supplied together by means of sympathetic nervous system over here. So both will be the pains, both the parietal peritoneum pain, both the parietal peritoneum will pain, that will be carried by the somatic nerve system, and the visual peritoneum also will pain, that will be carried by the sympathetic nervous system. Based on the nerve supply, you have to differentiate over here. Getting it all? Okay. In the same manner, this is carried by that is the external hemorrhoids. From below the pectinate line, whatever the hemorrhoids occurs in this manner, the venous dilatations which are hanging downwards, these are termed as the external hemorrhoids. Here these will pain a lot because it is supplied by the pudendal nerve, which is the somatic nerve over here. But this is supplied by sympathetic nerves, but here the pain sensation will not be carried by the sympathetic nervous system. Getting it all right? So certain sympathetic nervous system at certain areas. I have already told you parasympathetic nervous system on the cerebral region, and over this sacral region will be carried by the parasympathetic nervous system, not the sympathetic nervous system. Certain areas will not be carried by the sympathetic nervous system. Like for example, visual pleura is supplied by the sympathetic nervous system or not? Visual pleura is supplied by the sympathetic nervous system or not? No. Then how, what is the use of sympathetic nervous system supplied to the lungs, right? Blood vessels, absolutely. Blood vessels, and of course one more. What is pain sensation will be carried over. Okay. But the sympathetic nervous system will be supplied to the visceral pleura. The pain sensation from the visceral pleura will not be carried by the sympathetic nervous system. Sympathetic nervous system supplying doesn't mean that all the time it will be carrying the pain. Getting it all? At certain areas it will be carrying the pain, but in other areas it will not be carrying the pain. Okay. So here also in the same manner, even it is supplied to the sympathetic nervous system, but these hemorrhoids will not be giving the pain through the sympathetic nervous system over here. Okay. So simply you are supposed to understand is this part is pain insensitive for the hemorrhoids, and this part is pain sensitive for the hemorrhoids over here. Getting it all right? So coming to the middle portion, the middle zone is termed as a transitional zone. Okay. This transitional zone contains abundant venous plexus over here. What are the venous plexus which might be present over here? That is nothing but from the which veins will be present over here? Inferior rectal veins over here. Above is the superior rectal veins, below is the inferior rectal veins over here. Okay. So those venous plexus will be abundant in the middle portion. That's why this portion appears more bluish in color. Get it? Above arteries and veins together, so it will be having more reddish in color, but here more venous plexus will be present, so it will be having bluish in color. These color codings are important. Okay. From below onwards will be which color? The dark color, because skin will be lying over here, so that's why the lower third will be having dark in color. Okay. So this intermediate zone or what is this? Transitional zone is divided from the lower one third, okay, or lower zone by means of a white line of Hilton over here. That is nothing but the Difference between the stratified squamous non-keratinized epithelium and stratified squamous keratinized epithelium. Both are derived from the ectoderm of it. Getting it on, right? Right? Hilton's line, white line of Hilton divides the stratified squamous non-keratinized from the stratified squamous keratinized epithelium of it. This is the skin part over here. Okay? Getting it on? So from here onwards, there will be anal orifice. This entirely is the anal orifice over here. Around the anal orifice, there will be foldings of the skin occurs over here. That is termed as corrugator cutis ani. Okay, at this buttock region over here, beyond the anal orifice, this will be folded into multiple folds into the inner aspect over here. Those folds of the perianal region is termed as the corrugator cutis ani. You should be asked in the examination. Okay, what is that? Corrugator cutis ani. Corrugator means multiple folds, just like the scrotum. Corrugated scrotum. Okay. The same way corrugator means multiple folds together. If you fold a paper into multiple folds, those are nothing but the corrugations over here. Okay. So the skin around the anal orifice over here is termed as the perianal skin. That will show corrugations in this manner. The skin will be showing corrugations in this manner. I will be showing in the viscera over here later on. Okay. That is termed as the corrugator cutis ani over here. Okay. So these are the three different zones over here, and we have understood already the nerve supply, blood supply, and why it is called the watershed line. Is it not? Watershed line is not for the different nerve supplies, not for the different blood supplies over here. It is only for the lymphatic drainage. Watershed line, this doesn't mean, it means, it implies that it is related to the lymphatic drainage, not to blood supply or the nerve supply over here. Always remember. Watershed line will be found over here also, the pharynx. We will be discussing that later. Okay. So watershed lines, wherever it is present, you are supposed to know, either for the viva or for the theoretical things over here. Okay. So this is about the anal canal over here. We have found out the interior of the anal canal, the lining epithelium, nerve supply, blood vessels, and lymphatic drainage. Getting it all? And then followed by this anal canal is controlled by two sphincters. What are those? One is the internal anal sphincter, one is the external anal sphincter. Which might be voluntary, which might be involuntary? External is voluntary. So obviously, internal is involuntary. Okay. So you can see that the external and internal are with respect to the transverse alignment over here. Transversely oriented internus muscle and externus muscle. Okay. See here, this is the anal canal over here. Adjacent to the anal canal, this part is the nothing but the internal anal sphincter. And further beyond, this three group of muscles belongs to the sphincter ani externus. Sphincter ani externus over here, sphincter ani internus over here. Both are divided by means of a fibrous sheath over here. Getting it on? So anal canal is surrounded by internal anal sphincter over here and external anal sphincter further outwards. Both of these are separated by a fibrous sheath over here. Okay. First of all, this internal anal sphincter is derived from the circular muscle fibers, hypertrophied circular muscle fibers of the rectum above. Getting it on? So the internal anal sphincter is derived from the circular muscle fibers of the rectum above. Okay. From that, it will be hanging downwards into the mucosa of the anal canal over here. Getting it on? So that's why this circular muscle fibers will not be reaching the bottom of the anal canal over here. It will be reaching almost of the upper 2/3 of the anal canal will be occupied by this sphincter ani internus over here. Because it is coming all the way from the rectum over here. Getting it on? It can't reach the lower region. It can't reach the buttock region over here. Getting it on? But external anal sphincter is derived from different muscle fibers over here. One is subcutaneous, just below next to the skin is the cutaneous, subcutaneous over here, and then followed by the superficial, and then followed by the deep muscle fibers over here. So these three are different muscle groups over here. It's not a single muscle group. Okay. So this muscle fiber is derived from the circular muscle fibers of the rectum over here. Okay. So circular muscle fibers will be supplied by which nerve of the rectum? Roughly. Rectum will be having the smooth muscle fibers. inner circular and outer longitudinal muscle fibers. Both the muscle fibers will be supplied by sympathetic and parasympathetic nervous system. That's why the internal sphincter is involuntary. You are not controlling the peristalsis of GAT. So that is involuntary. Same thing applies over here for the anal canal, internal sphincter over here, because this is derived from the circular muscle fibers of the rectum, which is mediated by the autonomic nervous system. So this sphincter is involuntary, but this sphincter is voluntary. So if this is involuntary, obviously the other sphincter must be voluntary. Is it not? Just like the urethral orifices, urethral sphincters also. Okay. This fibrous sheath in between the two, that means internal sphincter and external sphincter, is derived from. One is the levator ani and one is the longitudinal muscle fibers of the rectum. So far we have seen the circular muscle fibers of the rectum which has formed this internal sphincter, and now the outer longitudinal muscle fiber and the levator ani muscle on either sides, they will be joined together and forms a conjoined sheath over here. That, for example, imagine this is the longitudinal muscle fiber of the rectum over here, but in the form of a sheath. So that divides the sphincters, both the sphincters over here. Okay, and the sheath goes downwards over here, and will be attached to the skin outside the anal orifice. So that is nothing but the perianal skin over here. Okay, so this will be attached over here. Again, this will be attached over here. This will be attached over here. So whenever the involuntary contraction of these muscle fibers occurs, there will be pulling of the skin occurs over here. So the corrugator cutis ani will be produced at this level over here. Getting it or not? That means the perianal skin will be thrown into multiple folds over here because of this attachment over here. Getting it or not? Getting it or not, right? So these fibers will be pulling the skin over here. So the folds of the skin will be produced. That is called the corrugator cutis ani over here. Okay. Okay. Okay, one more thing, there is one medial fibrous sheath over here. See here, there is one medially going fibrous sheath over here that will be attached to the Hilton's line. And the white line of Hilton's producing a groove, anal groove over here. Because, for example, the two fibers are pulling on either sides, they forms a groove within the anal canal. Do you understand or not? Right? So, if these fibers are attached on either sides of the anal canal, if it is pulling on either sides, it will be folded. If my shirt, if I put it on either sides, it will be folded over here. This is the center. The same manner, so if it is pulled on either sides, there will be forming a groove over here at the level of the Hilton's line over here, which is termed as the anal groove over here. Getting it? Here there are folds of the skin, and here is the anal groove over here. Okay. So this is about the sphincters around the anus. So how the external sphincter is formed over here? How the external sphincter is formed over here? There is a muscle called the superficial part of the, subcutaneous part of the sphincter ani externus. So this is very much close to the skin over here. It is not attached to any bone over here. Get it now? So this superficial fibers will be around the anal canal over here, which is subcutaneous over here. That means below the skin, just like the muscle over here. What is this muscle? Palmaris? Subcutaneous muscle. What is it? Palmaris brevis. In the same manner, there is a subcutaneous muscle called the subcutaneous part of the sphincter ani externus over here. Okay. So this is lying close to the skin over here, but will be around the anal orifice over here. Getting it? Over the perianal skin. It is not attached to any bone over here. Getting it? So it will be present over here. Through and through. It will be in this manner, around the anal canal. Getting it? Even these two other fibers also will be around the anal canal, controlling it. Okay. But the middle fibers, these fibers will be derived from what is it? See here? So now we are focusing from the below upwards, perineal region over here. This is the coccyx over here, and this is the perineal body. So in between the perineal body and the coccyx, this area is termed as the anal orifice over here. Anal canal or anal orifice you can take. Okay. So this is a middlemost part. That is nothing but the superficial part of the sphincter ani externus over here. Okay. Here it is attached to the anococcygeal raphe. What is anococcygeal raphe? What is it? From the tip of the coccyx, there lines the interdigital fibers over here. Of this sphincter that is forming the anococcygeal raphe. Okay, that means this muscle is attached in front to the perineal body and behind to the tip of the coccyx over here. So there is a bony attachment over here. Get it out? So this forms the superficial fibers of the sphincter ani externus over here. And one more, there will be deep part of the sphincter ani externus, which will also be in the same manner over here, but that will be attached to on either sides to superficial, what is it? Transverse, superficial transverse perineal muscle, okay, on either sides, you can expect, right? So this muscle will be arising with a cylindrical form over here, but will be attached to the muscle fibers, nothing but the superficial transverse perineal muscle in front over here. Can you imagine or not? The lower post will be over the skin and the middle fibers will be from the coccyx in the perineal body over here. One more muscle fibers, these are also will be attaching over here, but it will be continuous with the superficial transverse perineal muscles over here. That is the only difference. So you have to imagine this is the anal canal, this is the subcutaneous part of the sphincter ani externus, and then followed by the superficial part of the sphincter ani externus, and again deep part of the sphincter ani externus. So for example, this is the coccyx over here, the middle part. Superficial part will be arising from here and will be attached in front to the perineal body over here. So it will be in this manner, holding the anal canal over here. But above, one more deep fibers will be there over here. Those also arranged in the same manner, but will be continuous with the superficial transverse perineum on either sides over here. Getting it on? So this is the different layers of fibers surrounding the anal canal over here. Got it? Understood or not? Right? So one thing is, see here there will be into this sinuses there opens the anal glands. What is it? Anus contains glands. Is it or not? Why anus must be containing the glands over here? Mucus secretion for the easy passage of the fecal matter over here. Okay. So these glands are situated, that means the ducts of these glands are opening into the anal sinuses over here. Getting it out? So these glands are situated in the submucosa of the entire anal wall over here. Okay. So if there is any infection of this gland, for example, okay, because of the frequent rupture of the fecal matter over here, they entered an infection over here. That means the organism has entered into the anal gland over here. This entire anal gland is infected. So what might happen later on? So the pus will be drained over here, and the anal canal internal aspect will be infected, or the pus will be going above over here just below the sphincter ani internus and will be infecting the structures above. What might be the structures which are present above? What is it? Above the anal canal, which structures are present? Rectum. Okay. Pararectal fossa or the rectum might be infected over here. Okay. And then what are the other chances? This abscess, for example, the pus formation over here is nothing but the abscess. Abscess means the pus-filled cavity is termed as the abscess. Okay. Pus-filled cavity is termed as the abscess over here. Okay. So if the abscess has formed over here, the abscess may grow towards that means go towards the upper aspect, or the abscess may go towards the lower aspect towards the perianal skin. So if the pus is going over here, what might happen over here? It might pierce the skin over here and the pus will be drifted downwards over here. Okay. So there is a communication between the inner aspect of the anal canal and the outer aspect of the skin over here. So this tract is termed as, if one cavity is communicating with the other area, that is termed as fistula, anal fistula over here. Okay, what's it? Anal fistula. So if the pus is draining towards the anal canal and also draining towards the perianal skin over here, piercing the skin and the trickling downwards over here, making an opening over here. So this is one opening over here another opening over here. There is a communication between the inner aspect of the anal canal and towards the external environment over here. So this communication is termed as the anal fistula over here. Okay. Sometimes this abscess might perforate or pierce through these sphincters and goes towards the lateral aspect. Which thing is present over the lateral aspect over here? A fossa. What an object? Ischiorectal fossa. Okay. So here is a rectum over here. There will be the ischium over here. Ischiorectal fossa. Above that ischiorectal fossa will be. Above the ischiorectal fossa will be which fossa? It's not fossa. It's a space. What's the space? What's the space, right? Reticular space. Absolutely. See here. This is the urogenital diaphragm over here. Behind that there will be pelvic diaphragm in this manner. Above this diaphragm will be the space of reticulus. Below this will be the ischiorectal fossa. Getting it out? So on either sides of the anal canal and the rectum will be the ischiorectal fossa over here. Above that everything in the posterior true ligaments of the urinary gland there will be space of reticulus. So by this you can understand space of reticulus is above the pelvic and urogenital diaphragms, and below the urogenital diaphragm will be the ischiorectal fossa. Could you even understand or not? Right? So this pus can enter into the ischiorectal fossa and infect the entire ischiorectal fossa, again producing the fistula over here. Getting it out? Either through this way or entering into the ischiorectal fossa, again there must be communication through the skin to the exterior over here. Again the fistula will be formed over here. What is it? Anal fistula will be formed over here. Got it now? Right? So that's nothing more than the Disney reference.